Dr. Martin Loehr and Dr. Thomas Dill have been running the Clinic for Prostata-Therapie in Heidelberg since the year 2011.
Most clinics cover the entire spectrum of urological diseases and rely on standard treatments, whereas our clinic has a 20-year history in applying novel technologies for a good and gentle treatment of prostate diseases. As a result, we were among the first institutions in Europe to apply these therapies on a regular basis. On the one hand, we use the green light laser therapy, which has been successfully applied in our clinic for about 20 years now. Our experience allows us to preserve the ejaculation in almost every case. We also make every effort to avoid incontinence, of course. Furthermore, there is a range of prostate tumors which can be detected by accurate diagnostics. We work together with a high specialized radiologist who provides us with a multiparametric MRI for MRI-guided so-called 3D biopsies. We do not insert the biopsy needles through the germ-contaminated rectum based on a random principle. In our clinic, the samples will be taken from suspicious areas of the prostate via the perineum with a very high level of precision. The advantage of the precise biopsy is that relevant existing tumors will be identified in contrast to the biopsy based on a random principle. Using the conventional method, about 50% of all tumors remain undetected and can be underrated. This leads to wrong decisions regarding the choice of treatment. This offers an important advantage. The perineum is the area of skin between the scrotum and anus. The prostate is located directly behind that area. The skin can be disinfected before tissue removal, which is very important during a procedure. That means that we insert a germ-free needle into the prostate. Experience has shown that this allows us to lower the risk of fever and chills. Due to the biopsy result and the MRI images of the prostate, we can identify whether one of our special treatments, a partial treatment with organ preservation with HIFU or nanoknife, can be an option for the patient. HIFU stands for High Intense Focused Ultrasound. During HIFU therapy, the prostate will be treated by heat with pinpoint accuracy without surgery. During this minimal invasive procedure, the ultrasonic probe is placed directly in front of the prostate via the rectum. For this procedure, we use the Sonoblade 500 from the US company Sonacare. Dr. Dill and me have performed approximately 1,000 treatments since the year 2011. Special needles are placed via the perineum around the tumor, so strong, very short electrical impulses destroy cancer cells in the targeted area. The patient can leave the clinic after only one night stay under medical supervision and can go home on his own. This is not a standard surgery. These methods are very gentle on the male organism. treatments are a perfect approach for a partial treatment. The choice of the right therapy mainly depends on the location of the tumor. Both treatment methods have their advantages, therefore it is very important to offer different procedures. The standard procedures treat a whole gland, while we are trying to treat only the cancerous part of the prostate. Therefore, side effects such as impotence and incontinence are virtually excluded. Our treatments can be a possible alternative for many patients. The relevant medical reports will help us to decide which approach would be the right one.